The new Bendigo Hospital, of course, is a critical investment by the Victorian Government within the Loddon Mallee region and the city of Bendigo specifically. The hospital provides a fantastic digital platform. It's a very technologically enabled environment, and that platform has given us the opportunity to really commence our digital patient record journey. The first stage of that journey has been implementation of our digital medical record, the DMR, and that has, I suppose, started to pave the way for Bendigo Health and the region more broadly towards the key quality and safety improvements that can be expected through the implementation of electronic patient records. Well, I guess there are two kind of domains that I think are critical with this. One is the change management domain. These are clinical change projects that are supported by information technology. So I think we've been tracking our own performance in delivering and implementing clinical change, but we've also then been tracking a number of benefits that we defined associated with the digital journey. In particular, benefits, some very hard financial benefits associated with reduction of paper and the handling of paper and so forth, but also benefits in relation to information availability to clinicians in real time in multiple places, for example. So we have a defined process of tracking those benefits and monitoring those benefits, and the metrics would say overall this is a good change for us. The vision, the sort of strategic intent of Bendigo Health and the region more broadly is really underpinned by the principle of sort of one record across the geography for the patient, available in the right place at the right time.
The Digital Medical Record project for Bendigo Health was a key platform for moving into our new hospital, and we found that a smart hospital has to have the right architectures and has to have the platforms to enable us to move in a staged process to electronic medical record. So the Digital Medical Record project gave us that opportunity, and it's been a successful implementation, both at a clinical sense and from an administrative sense. So if we look at the key benefits of digital medical record for Bendigo Health, primarily around access to the digital record from anywhere at any time. It's an old cliche, but it's a true cliche that says that paper medical records are really only there for the individual and not to be really shared. Digital medical record allows us to share the patient information across a breadth of our services, including aged care, community health, the acute, and even into our psychiatry services. So the key message, I think, from a digital medical record is that you'll be able to share data widely across the organisation. It's timely, it's good quality capture, and it's a safe way to manage our data. Bendigo Health was built as a smart hospital. There's certainly a lot of technology and a lot of integration and complexity, and part of that, the digital medical record provides us with a platform that goes forward in a staged process to integrate to a range of our other legacy applications. Vision, I think, is the acknowledgement of data quality. If you've got good data quality and you're capturing data quality by the bedside, which you can do with the digital medical record, then that enables us to look at clinical analytics, business intelligence, and population health management as we move forward.
The transition from paper to digital was made much more streamlined by having the records are identical. So the digital record looks exactly the same as the paper record. So staff didn't have to learn anything new, just how to navigate the software. For our service, which is an acute service, which require to use the medical records, we've been off-site, and prior to the digital record we would have to go to the medical record department to obtain a file and then be able to maybe photocopy it or have a look at that file. Now we've got access immediately, so that is a huge advantage for a community service and a service that's off-site from the main campus as well. One of the advantages of a digital record is that when you enter that information, it's got the date and time, so that's got evidence of your care.
Since using electronic records, we've been able to be very mobile with our records, being able to take them over to the bedside of the patient or the chair that they're receiving chemo in, and it's all accessible there, right there in the computer. So the difference between having a paper record and an electronic record is been quite critical in the success of the unit. We are now able to access everything online straight away instead of having to go back into old histories and look them up. Yeah, it was relatively easy to learn to use the platform. Just a couple of hours of training and then we were able to go off on our own and use it independently. Everything's put onto a database and for example, if the patient we give chemotherapy to in the morning is readmitted in the afternoon through ED, they have a record, the medical staff in the emergency department have a record of what we gave them in the morning. So it's all there online. There's a range of things that I really enjoy, enhancing patient-centred care to the mobility of taking the computer over to the patient, even the fact that you have up-to-date notes from not only nursing staff but all allied health professionals, all accessible just at the click of a button.
We moved from a hospital that used paper documents, then we've gone to the new hospital that's got DMR system. So going from using paper and having patient files and then now to DMR has been really accessible. It's really fast, we have to do a swipe on and it comes up, it's very readily available and we can access, even when a patient's down and having a scan, we can still access information while we're on the ward, or if we do transport the patient down, we can still access it in the computers down there. When you're working with other nurses, the patients that you're not looking after as well, you can easily access their information. It just makes the processes and tasks as a nurse really efficient. The paper-based system was very time-consuming. We usually have to go and find the folder, and often doctors will take that away to do a discharge script, or they might have to go alter a medication chart. Whereas here, some of all the documents aren't on DMR, but you can still access, I guess, progress notes and things like that. So we just find it's more readily available. We don't have to take time out of our day to go and look at the file. It's always right there in front of us. For me, I have obviously gone through uni and school using technology, so for me it was quite easy. Some of the more senior staff that have been nursing for a longer amount of time didn't take as long as that we thought to use the program. It is quite easy. It's all very much like a one-step process. It's all quite easy and stress-free.
In regards to access to the records now that we are digital, it's made quite a big impact for us within health information services. As you can see, it's been a very physical process to be able to pull records and to get records for clinics and for emergency presentations, and so that workload has really decreased dramatically since we've gone live with our digital record. It's made the process of getting information and finding information a lot easier. We've had a decrease in manual handling risks, which has been a really good result of having the digital record. It's something that I think all health information services have an issue with, and it's something that they all have to contend with. And so it's been really nice to see that transition from paper to digital, and just to have those decreased risks and have some real cost savings for the organisation as well.